topic is germicides, antiseptics, and disinfectants. Germicides, antiseptics, and disinfectants. Okay, you must have heard of these two terms, antiseptics and disinfectants. If you're not careful, you may use two of them interchangeably. They are not exactly the same thing, but both of them are classified under germicides. Germicide from germ, sides, kill. They kill germs. Okay, cider, killing germs. Now, antiseptics, disinfectants. So let's delve into it. What are germicides? Germicides are basically chemical substances used for non-selective killing or inhibition of growth of microbes. When I say microbes, I'm talking about bacteria, viruses, fungi, protozoa that are harmful to the body, that are pathogenic to the body. When they come in contact with these microbes, they kill non-selectively. They non-selectively kill or inhibit their growth. So that these substances are known as what? Germicides. But basically, there are two of them, two categories of germicides. We have the one we call antiseptics, and we have the ones we call the disinfectants. Okay, so what are antiseptics? Antiseptics are germicides that are applied on living surfaces, on the body of living organisms. They are not used internally; they are used externally on living organisms. Living, the watchword there is that they are used for living organisms, but they are not like antibiotics you take inside. This one you apply them on living organism. Okay, so they are antimicrobial. I've mentioned that. So they are applied on the body of living organisms. So I inhibit the action of these microbes. As I said before, now they are not injected like antibiotics. Okay, so they are there to take care of what? To heal the living tissues in a situation of wounds or cuts. When the organism sustain an injury or cut, to heal the wounds or cut, you will apply antiseptics. So what of disinfectants? Disinfectants are not applied on living organisms. They are not meant for living organisms. They are applied on the surface of inanimate objects to keep them sterile, to reduce or to clear them of microbial deposition. So the surfaces in the hospital, surfaces at homes, surfaces in different places, even the equipments we are using for different things, they are prone to the position of microbes that may gain entrance into the body system, into living organism. So to sterilize such environment or such equipment, you use disinfectants. On those inanimate objects. Okay, so this is the major difference between disinfectants and antiseptics. Now, for a substance to be used either as disinfectants or as an antiseptics, there are different properties the substance should have. Number one is that the chemical substance should be chemically stable. It should be stable. Of course, it should be cheap, cost effective, and it should be readily available. So it should be what? Chemically stable. It should not be moving from one form to another form, changing forms. So it should be careful. It should be chemically stable, and it should be cost effective. At the same time, it should be readily available. Whatever is needed, we can source it. Good. That's number one. Number two is that it should be able to have antimicrobial activity. Be it statics or cider. Most especially antibacterial activity. You should have antimicrobial activity, because I wouldn't stop at antibacterial activity, because antibacterial is not the only pathogen. There are other pathogens. So you should have a strong antimicrobial activity against all pathogens. It should be not, from the definition I gave, the germicides are not selective. So you should have general activity on all pathogens. That's one of the features of an ideal disinfectant or antiseptics. Good. It should not just be active against the organism itself. You should also be active against the spores of the organism. Spores. Yes. Because if it attacks only the organism itself, the spores will germinate and more organism will come out. So it should tackle both the spores and the pathogen itself. So this is an ideal disinfectant or an antiseptics should have this problem. It should have activity against the spores of the pathogen. Because it's these spores that will grow up tomorrow and become the pathogen. So irrespective of what is present, in the presence of anything, it should be active, even in the presence of blood. If the blood is there, even if there are spores or isolates from the body, it must be what? It should be able to show it to be active, even in the presence of all this I mentioned, even in the presence of blood, in the presence of pus, and in the presence of what? Isolates. So an ideal disinfectant should have activity like that. Now, it should not be corrosive. It should not be corrosive. It should not stain. It should be non-stain. It should not be allergic. It should be non-allergic. And it should also be not what? Irritating, or allergy. It should not irritate any part of the body. It should not also elicit allergic reactions in the body. So these are the purpose of an ideal disinfectant or antiseptics. And it should be compatible with water, very, very compatible with water, because you need to sometimes you dilute, especially disinfectants. You dilute before using it. So it should what? It should what? Compatible with what? Water. And it should have the ability to do what? Penetrate any opening, any crevices. It should penetrate. Should be penetrate into different areas when used. So it should what? Have the capacity to penetrate crevices, cavities, and even fill of organic matter. You should have the ability to do what? Penetrate crevices, cavities, and fill of organic what? Matters. These are some of the features of an ideal, or properties of an ideal disinfectants or antiseptics. Now, how do these disinfectants, how do they carry out their activity? How do they carry out their activity? They have different methods. In fact, we have different classification, and each of them they have a different methods of what? Different mechanism of what? Activity. They have different mechanisms of what? Activity. But these activities are classified into the following. There are those that are oxidizing agents. There are those that are oxidizing agents. They oxidize the microbial protoplasm. They oxidize the oxidizing agent, one metals and reducing agent. So halogens like chlorine, fluorine, these ones are non-metal. They are highly powerful non-metals and they have oxidizing properties. So halogens and halogen derivatives, they oxidize the microbial protoplasm, thereby destroying it. Then next, there are also groups of these disinfectants that target the protein and enzymes of this microbe, the proteins and enzymes of these microbes. What they do, they denature, some oxidize, some do what? Denature. Some denature the microbial protein and what? Enzymes. Then some target the integrity of the what? The microbial membrane. They interfere with the integrity of the what? Microbial membrane. So they interfere with permeability of the what? Microbial membrane. Okay, those that denature, example, we see things like phenol derivatives, metal, alcohol. These ones are what? They denature the microbial protein, example enzymes. While those that interfere with the permeability of the membrane of these microbes, examples are detergents. Examples are what? Detergents. Detergents interfere with the microbial membrane, permeability of the microbial membrane. Permeability of the microbial membrane. So that's what the detergents do. Okay. Now, let us now do a rundown of the classes of these antiseptics and disinfectants. Classes. After listing the classes and few examples, we now take them one after the other. So, the classification. Number one, the first class we look at is what? Phenol derivatives. Phenol derivatives. Examples of phenol derivatives, you see the phenol itself, cresol, resorcinol. Phenol derivative, we have phenol. Phenol derivative, we have phenol. We have phenol. We have cresol. We have resorcinol. We have phenol, we have cresol, we have resorcinol. These ones are phenol derivatives. These ones are the phenol derivatives. We have phenol, cresol, resorcinol. Now, then number two class, we have oxidizing agents. Under oxidizing agent, we see things like potassium permanganate is also yes. Potassium permanganate, hydrogen peroxide is also there. Potassium permanganate, hydrogen peroxide. Potassium permanganate, hydrogen peroxide. We have potassium permanganate, potassium permanganate, hydrogen peroxide. Potassium permanganate, these are what? Oxidizing what? Agents. They are oxidizing what? Agents. They are oxidizing what? Agents. Even halogens are also oxidizing agents. Halogens. Under halogens, you see things like iodide, iodophore, chlorine, chloride. These are the halogens. Iodide, iodophor, chlorine, chlorides. Then we have biguanides, chlorhexidine. Biguanides, that chlorhexidine, the one we find in our sets, in our brand. There's a big popular brand, Savlon, chlorhexidine. They are also classes of what? Antiseptic / disinfectants. Now, we will have soaps. Soaps are also one of the classes, but soaps are anionic detergents. They are actually anionic what? Detergents. We have their what? Sodium and potassium salt. We have a sodium and potassium salt. They are under what? Soap. Alcohol. Under alcohol, we have ethanol, isopropanol, and that is isopropyl alcohol and water. So these are the what? Ethanol. We don't have aldehyde. Aldehydes are also under group. Aldehydes. Under aldehydes, we have your popular formaldehyde. From where you get your formalin. Formaldehyde, formalin. From there you get formalin. Formaldehyde. Then we have what? Glutaraldehyde. Formaldehyde, glutaraldehyde. Formaldehyde, formaldehyde. We have glutaraldehyde. Formaldehyde, glutaraldehyde. Okay. We don't have acids. That is cities like boric acid, acetic acid. They are also disinfectant acid. Boric acid, acetic acid. Then the next one is dye. We have dyes. This is where we have your GV, your gentian violets, proflavin, scarlet red, brilliant green. The most popular is our what? Gentian violet. It comes from dye. Okay. Now, the last one I want us to look at is the furan. Under this furan derivatives anyway. Furan derivatives. You start seeing things like nitrofurazone. These are the classes of what? Antiseptics, disinfectants. So let's take them one after the other. Let's start from the phenol derivative. I've already mentioned examples. We'll take them one after the other. Phenol derivatives are used both as antiseptics and what? Disinfectants. They are used both as what? Antiseptics and what? Disinfectants. They are used both as what? Antiseptic and what? Disinfectants. Let's start with phenol. Phenol, in the concentration of 2 to 5%, aqueous phenol, 2 to 5% aqueous phenol, it has antibacterial, antiviral, antifungal activities. So 2 to 5% aqueous phenol is used as what? Antibacterial, antiviral, and antifungal disinfectants. It doesn't stop there. It also kills spores from anthrax and mycobacterium. It also kills spores from anthrax. Spores of what? Anthrax and what? Mycobacterium. Kill mycobacterium. Kill spores of anthrax and what? Mycobacterium. It's powerful. As I said before, now mainly used as what? Disinfectant. Phenol. Mainly used what? As disinfectant. Actually, phenol is the first disinfectant and antiseptic used by Joseph Lister. Phenol is the first disinfectant and antiseptic used by what? Joseph Lister. Okay. So how does it exhibit how does this effect exhibited? Phenol derivative targets the cytoplasmic membrane of bacteria. They target what? One, for bacteria, they target the cytoplasmic membrane. They target the membrane of bacteria. Then, they also denature the protein. They also do what? Denature the protein. And they act as cytoplasmic poison. Membrane, denature protein, cytoplasmic what? Poison. Multifaceted action, activity, shaking. That's why it's powerful. Then for virus, what does it do to virus? Surrounding where a stay mess up the dog. Please, let's be careful about that. Those are real dogs and cats. Okay, this is for you. Alright, so let's look at the oxidizing agents in general. Let's look at the what? Oxidizing agents. These oxidizing agents are short-acting germicides. They are what? Short-acting germicides. So what they do? They release oxygen. They release nascent oxygen. What does it do? This oxidizes the bacterial protoplasm. This oxidizes the bacterial protoplasm. So at what concentration do they carry out this function? Example of the hydrogen peroxide. 3% solution of hydrogen peroxide is you can use to clear, of course, those that have gone to mess hospital or or a nurse to clear or to dress their wound. You see them using things like hydrogen peroxide. Yes, this is why they use hydrogen peroxide. 3% hydrogen peroxide used to do what? Clear pus. Used to clear pus and debris from wound. Used to clear what? Pus and what? Debris. So they use it to clean the wound. That's why they use what? Hydrogen peroxide. 3% hydrogen peroxide is used to clear pus and what? And debris from what? Wounds. Then another is use that is used for what? Dental sterilization of dental surgical instruments. Instruments used in dental surgery. They are used to clean the instrument used in what? Dental surgery. Very important. Good. Now, oxidizing agent again, I want us to look at is what? Potassium permanganate. Potassium permanganate. See the formula here. Potassium permanganate has a broad spectrum antimicrobial activity. It has a broad spectrum antimicrobial activity. It attacks bacteria, it attacks fungi, it attacks viruses. Then the ratio strength of the solution used is 1:5,000. Please note this percentage concentration. That's very important. Remember phenol 2 to 5%. Remember this hydrogen peroxide 3%. Now, potassium permanganate 1 in what? 5,000. Of course, this can be changed to percentage. This can be moved from ratio concentration or ratio strength to what? Percentage concentration. This can be moved from where? Ratio strength to what? Percentage concentration. Can be moved from ratio strength to what? Percentage concentration. Now, let's continue. Now, 1 to 5,000 solution of potassium permanganate is used to do as antiseptic for mucous membrane and wounds. 1:5,000 solution of potassium permanganate is used as antiseptic for what? Wounds and mucous membrane. But there's an issue there. This potassium, the color is so strong. It stains. It stains tissues. It stains tissues and can promote what? Rusting. It stains tissues and can promote rust. That's why they don't use it often. They don't use it like that. Maybe that may be the reason. Halogen peroxide is used more in dressing. Let's continue. Let's go to halogens. Let's go to what? Halogens. Basically, halogens are used as topical antimicrobial agents. They are basically used as what? Topical antimicrobial agents. So what do? They bind to the protoplasm. They oxidize protein and interfere with the what? Metabolic function, important metabolic functions of the what? The microbe. They bind to the protoplasm. Of course, you know what they do when they bind to the protoplasm. They mess it up. Then they also do what? They denature what? The protein. Not just denaturing the protein, they interfere with vital metabolic functions in the what? Organism, in the microbes. So here we see something like iodine. Iodine is very, very effective, whether there is organic matter or not. In presence of organic matter, it doesn't care. It's very, very what? Effective. Now, iodine can kill both in fact, it can kill both the pathogen and its spore. It can kill both the pathogen, the bacteria, and the spores. It can kill both the vegetative and sporulating bacteria. Let me put it that way. And it's very, very active. It's highly active, especially when it is in the form of tincture. Of course, you know what tincture is. We know what iodine tincture is. Tincture is nothing but what? Solution of iodine in what? Alcohol. A tincture is the solution of what? Iodine in what? Alcohol. So iodine is very, very active, highly active when dissolved in alcohol to form tincture. Okay. So when you want to dress things like umbilical cord or dressing of wound, maybe before and after operation, operation, you want to sterilize the site. Before and after operation, you want to dress umbilical cord, you want to dress an excised wound. Weak iodine solution is used. Weak iodine solution or tincture is used. What do you mean by weak iodine solution or tincture? It's just 2% iodine and 2% potassium iodide in water or alcohol. 2% iodine, 2% potassium iodide in water or alcohol. Please, let's put this thing down, okay? Okay. Now, a weaker solution, about 0.25%, is also used as what? For as uterine and vaginal douche. You know the dosage form we call douche. It's used for what? Uterine and vaginal douche. It's used as uterine and vaginal douche. A weaker solution as 0.25%. is used for what? Uterine and vaginal douche. Especially, of course, we are talking about when you have what? Vaginitis in what? In cattle. When you have vaginitis in what? Cattle. Or metritis in what? Cattle. Let's note that. Vaginitis and metritis in what? Cattle. Now, this is for what? Iodine. Let's look at chlorine. What of chlorine? Chlorine has a broad spectrum antibacterial what? Antimicrobial what? Activity. It attacks both bacteria, virus, and what? Protozoa. So at what concentration does it do this? At what concentration does it do this? Chlorine exerts this effect at concentration of what? 0.1 to 0.25 parts per million. ppm, parts per million. Chlorine undergoes carry out these activities at concentration of what? 0.1 to 0.25 parts per million. It's also a concentration term anyway. Parts per million. Good. It can be moved. This part per million can be changed to percentage concentration. It can also be changed to what? Ratio concentration. Stay with us tomorrow for PharmCalc. We may solve questions that has to do with this tomorrow for better understanding. So, one thing is that this chlorine is generally used as what? Disinfectant in water supply. Note that point. Disinfectant in what? Water supply. Disinfectant in what? Water supply. But there's an issue with chlorine. Chlorine have no effect on what? In fact, acid-fast organism. Acid-fast halogens. Let's look at what? Bagwanites. Let's look at bagwanites. I mentioned an example of bagwanites, chlorhexidine. Used in the formulation of what? This popular brand Savlon. Chlorhexidine in what? Savlon. So what does it do? Chlorhexidine is non-irritating and is a very powerful antiseptic. It is a synthetic cation. It is cationic in nature and is what? Synthetic. Is very good as what? Antiseptic. Very powerful antiseptic. So what is it normally used for? Basically for topical antiseptic and it's used basically for topical antiseptics. It's also used in wound cleansing. It's used in wound what? Cleansing. Topical antiseptic and in wound cleansing. So what does it do? It kills bacteria. It kills bacteria. It doesn't do anything. It kills bacteria. How does it kill the bacteria? It attacks the cell membrane. It will attack the cell membrane and precipitate. Whether there is blood or whether there is necrotic tissue or pus, it doesn't care. It's still effective. Its action is not affected by presence of blood, pus, or any necrotic tissue, any debris. It doesn't care. And it has a sustained residual effect. It has a sustained residual effect. Even after applying, keep acting. It has a sustained residual what? Effects. So whether there's other organic matter, whether there is a pus, whether there is blood, whether there is necrotic tissue, it doesn't care. It exerts its effect. That's how powerful chlorhexidine is. It's a powerful antiseptic. We have 4 minutes to go. Okay, let's look at soaps. I said before when I listed the classes, I said that soaps are anionic detergents. If you do your organic chemistry well, you realize that the formula for soap is RC00. Here can be sodium or what? Potassium. Here can be sodium or what? Potassium. Why this R is the what? Fatty what? As positive organism and acid fast organism. Remember that chlorine But for soap is active against acid-fast organism and gram-positive organism. Note that point. So what is it used to? What do we use soap for? They are used for what? To scrub our hands and even the operation sites. They are even effective in acidic condition, of course, if they can deal with acid-fast organism. So they are effective in acidic what? Conditions. They don't care. What are the examples of this soap? Quaternary ammonium compounds. Quaternary ammonium compound. Quaternary ammonium compound. Of course, they are quaternary and ammonium compound are cationic surfactants. So, quaternary ammonium compound, they have what? Germicidal what? Activity. They have germicidal activity. They have germicidal what? Activity. Okay, I think we'll stop here for today. In our next class, by God's grace, we'll continue from alcohols. In our next class, we'll continue from what? Alcohols. We started from defining germicides, the two germicides, properties of an ideal. We mentioned antiseptics and disinfectants. Properties of an ideal antiseptics or disinfectants. We now went down to what the mechanism of actions of disinfectants and the antiseptics. We categorize them into three main mechanism of what actions. We now went down to what listing different classes. We said up to 10 classes of these antiseptic disinfectant and examples of each of them. And we now pick them one after the other. We have treated phenol derivatives. We have treated other oxidizing agents. We have treated halogens. The concentration at which we talked about the concentration at which they carry out the activity. We talked about their spectrum of activity, what they can attack and what they cannot attack. We also talked about their use, whether they are used as disinfectant or what antiseptics. So these are the things we treated in each of them. Then after that, we now went down to the big grammars, after which we now stopped at soaps. In our next class, we continue from where? Alcohols. Thank you very much for your attention. Please subscribe to my YouTube channel. My YouTube channel name is Chaitanya TV. Subscribe to my Facebook channel too. Follow my Facebook page. My Facebook page is Chaitanya TV. Now for live lectures, if you want to watch live lectures, you either go to Chaitanya TV on YouTube or go to my profile on Facebook from Sister Zanya Emmanuel Chaitanya at Chaitanya TV 83 on Facebook, at Chaitanya TV on YouTube for live lectures. But if you want to watch live recordings like this live lecture now, the recording will be posted to my other YouTube channel, Susan Limited, if you want to watch it on YouTube. But if you want to watch it on Facebook, you can also go to Chaitanya TV. I also upload this live recording there if you want to watch the live recording. But it's also there on my profile on Chaitanya TV. But sometimes why I upload it is sometimes due to network. If you want to go and watch this live again, you will notice that they cause some minutes we are cut off because of network issue. But the one that is recorded is always complete. That's why I post the live recording. Thank you very much for your attention. God bless you. Please, we are coming back by 6 p.m. dots for the last lecture for the day, which is essential medicines. Essential medicine. Also under what? Pharmacology. See you by 6 p.m. God bless you.